Thank you. Good afternoon, everybody. I'm Joan Farini-Mundy. I'm the president of the University of Maine and our regional campus, the University of Maine at Machias. Thank you so much for joining us this evening to discuss and to answer some questions about the joint health and safety, excuse me, plans for UMaine, for Orono, and for Old Town. We've been working collaboratively to keep all of our community members as safe and healthy as we possibly can during the COVID-19 pandemic. And of course, we have a lot of mutual interests, and I'm delighted that we're able to bring folks together and talk here tonight. Excited to be here with Sophie Wilson, who is the town manager for Orono, and Bill Mayo, the city manager for Old Town. And at this time, I'd like to ask our community leaders to introduce themselves and their teams so that we can know who's here, and then we'll get started. So I'll turn it to you, Sophie.
Good evening. Thanks for having us. We're very excited to be here with you tonight. I'm Sophie Wilson, town manager for the town of Orono. Tonight, I have my public health team with me, which would include the fire chief, Jeff Lowe, and my chief of police, Josh Ewing.
Great. Thanks, Sophie. Welcome to our partners from Orono. Bill, can you please let us know who's here from Old Town? Oh, it's Travis Roy replacing Bill. Okay, great, Travis.
All right. Yeah, my name is Travis Roy. I'm the assistant city manager. Sitting in for Bill tonight. He was otherwise obligated. And I'm joined by our deputy police chief, Lee Miller, and our deputy fire chief and EMS director, Chris Baker.
Terrific. Thank you, Bill, and welcome to our partners from Old Town. The UMaine team today includes several members of the president's cabinet, as well as people from our student life team, from our EOC, our emergency group, and our scientific advisory board. So I'll just sort of point to them and let them each say their own title and say hello to you. So first of all, John Vollen, and I will say that John is new to us. He's been here now, all of 2 weeks, John? He's the new provost, and he has just jumped right in. So John, please introduce yourself briefly.
Well, thank you, Joan, and hello, everyone. My name is John Vollen, as you just heard, and I am the new provost. I've been here 2.5 weeks, and so far I'm loving Maine. So this is great. Thank you.
That's good. Robert Dana, who is vice president for student life. Robert, if you could introduce yourself. You're well known to this group, I know, and also let your point to your staff and have them say hello.
I will. Thank you so much. It's good to see you all, and it's good to see everybody, at least virtually, out there in our neighborhoods and communities. I'm the vice president for student life, so I have a responsibility for a lot of things outside the classroom, and for the purposes of this meeting, also, I'm responsible for overseeing the Emergency Operations Center, and we have folks there as well. So I'll start with Kenda Sheely is here. Kenda, you can introduce yourself.
Thank you, Robert. My name is Kenda Sheely. I'm Associate Vice President for Student Life and Senior Associate Dean, and I welcome you all, and thank you for the opportunity to be here.
Thank you. And Roland?
I'm Roland LaCroix, Chief of Police at the University of Maine and Incident Commander of the Emergency Operations Center.
And I'm going to jump up. I'll ask Jeremy to introduce himself.
Good evening, everybody. My name is Jeremy Chubbuck. I'm the Associate Executive Director of Facilities Management. Very active in the EOC, and I'm in charge of the planning section of the EOC as chair.
Thank you, Lori.
Hi, everyone. I'm Lori Sidelko. I'm an Assistant Dean in Student Life, and I've been helping out with COVID response.
And Roland?
You already got me.
I got you already, Roland. My goodness, I'm looking for you all the time. Let's see, Andrea Gifford, how about her? She's out there.
Hi, I am here. I'm Andrea Gifford. I'm the Associate Dean of Student Life. And like Lori, we've been knee deep into the COVID stuff here on campus.
Now, Roland, did I introduce you yet? No. I think that's all of us, as far as I can see.
You forgot Dick.
Dick is up there. I don't see it. Honestly, I have such a funny little screen. So, Dick? Oh, there's Dick. You're on Zoom. Mute, Dick.
See, we're all right there today, Robert. Sorry. My name's Dick Young, Associate Executive Director of Auxiliary Services. And I've been in my job role with the EOC as the asymptomatic and symptomatic testing director on campus.
Well, I'm pretty sure we got everybody that time.
Okay. I would also like to ask Kimberly Whitehead to introduce herself. Kimberly?
Good evening, everyone. I'm Kimberly Whitehead, Vice President and Chief of Staff to the President, and I'm really happy to be here with you this evening.
And Margaret?
Hello, I'm Margaret Nagel, Director of Public Relations at the University of Maine.
Thank you. And you'll meet Melissa McGinnis in a moment. But thank you all. I just wanted everyone to know how excited the university team is to be able to be here with our local civic leaders to talk together about what happens when a university that has more than 11,000 students and lots of employees goes back into business after having been quiet for 6 months. And we know that it's of great interest to those who are out there listening. I know that people are sending in questions and we'll get to those, but we have a couple of brief presentations and I'll begin. So I'm going to share my screen and see if that works. And it's not looking like it's working, Josette. So if you wouldn't mind, we have a backup plan here. This is Josette McWilliams, who is Executive Assistant to the President. And most importantly, much more tech savvy than I am. So thanks, Josette. And we just wanted to share a little bit of a quick sense, quick sense of what it's like here now. And many of you have been around the campus and you're nearby, so you're actually seeing it up close. But first of all, we are very clear about the masking being a central feature for us. The face coverings are required on campus. And at the same time, I like this choice of photos, which I didn't make, someone else did, but basically at the same time that we're adding a lot of new features that can feel a little unsettling to our students and our community, the same wonderful spirit and warmth of the Maine hello, the Maine welcome is happening. And so we saw our new students coming in and our students coming back, and we still have students on the bridge saying honk if you love Maine. So let's go to the next slide, please. And the campus looks quite a bit differently than it might have looked the last time you were here if you haven't been around lately. And so in the upper left, you see testing facilities that were set up for our entering students. Melissa will tell you a lot more about our testing program. You see how our classrooms are now arranged at distance. These seats have been placed by our facilities teams and our safe return teams, and faculty have been asked not to move them around. These are spaced precisely so that people can be at appropriate distance and that the rooms don't have more people than they are supposed to have. Our rec center is open with very different arrangements and spacing. And this is across the entire campus. You can see that we have been preparing and the place looks quite different. Yes, next slide, please. You heard about the Emergency Operations Center a little bit when Roland introduced himself. And that has been the centerpiece really of our work here on campus. And many of you in the communities, of course, are part of this or are connected to it and know about it. But they are the central part of planning for the entire system with trained experts, specialists. They do practice sessions and tabletop exercises. So this is our sort of the nerve center of what happens on a campus in challenging times. And this has indeed been one of those. Below this, you see a list of a bulleted list, and I won't go through all of that, of all of the different planning organizations that we have had in place for the better part of the last 6 months, including a research continuity task force that grappled with everything from what can we really do safely relative to researchers being out in the field where they might need to gather samples in our rivers or in our forests. Can they really be out there in accordance with civil guidance, with the governor's executive orders and so forth? And so we've had a group all the last 6 months working through every one of those issues, every case, to decide what would be safe and what we do need to postpone. We've had a group that's been just focused on public space furniture arrangements and traffic in the buildings. Where are the hallways where you can go up the stairs, and where do you come down, because we want to avoid that distance concern as much as we possibly can. Many groups across student life and athletics, and you've followed a lot of this, I'm sure. So it's really to reassure you that we have been planning, and we've moved now from planning into implementation, where we constantly need to be ready to make adjustments as we learn more about what's happening. So next slide, please, Josette. We do have a website. You can see it here. It's the return website, and it has continually updated information. It links also to system websites where you can see system level, University of Maine system level information and so forth. And we're trying very hard to make sure that we're communicating well and are interested in hearing from you about the kinds of questions you have, because some of these can show up in our Q&As and FAQs, and we can make sure we're trying to get the best answers out to you that we can. Next slide, please. There are a few specifics that I would mention. I've already talked about the physical space preparation, and you see that shot again. So we're using our large halls, but with very few students, so that we can come underneath the appropriate required numbers for those spaces. We're very excited about the Black Bear Pact, and we have the Clipper Pact in Machias, which is a traditional public health agreement, kind of a compact that is encouraging people to do their part, to be a part of the community, to do what they need to do to keep themselves safe, to protect others, and then to protect, as it says here, the College of Our Hearts always. And our students have been acknowledging that they've seen this, as have our staff, and there are ways that we can show folks how that works. Testing is going on, and we'll turn to that in a moment. Dining is looking very different this time around. You see those great green containers. That's where students and folks are picking up their food, and then they can return those, and they're cleaned and they come back in. But largely students are not eating in the dining halls and are using spaces around campus in their rooms. And one piece of communication is the Friday Futurecast, where we try to preview what's coming in the next week so that people will have the latest information, because it changes very frequently. So the next slide. A little bit of specific data that I thought might be of interest to you. 2,800 students in our campus residence halls. And that's with 300 rooms on the campus being reserved as needed for quarantine and isolation. And of course, you see in the press that for many college campuses, that ability to quarantine and isolate as we hear of cases, and then as the contact tracing is done, to be able to have the space for that is really a critical factor in what the universities are able to do. And we're very happy to have that capacity at this time. So far, 7,543 students have participated in asymptomatic testing. And again, Melissa will tell you more about this. There is a dashboard that is updated daily that tells us the system level statistics around coronavirus. And so right now, across the entire UMaine system, with a testing regimen that has been extensive across all of our campuses, we have 13 current cases. And I urge you to take a look at that dashboard daily. Also, there are press releases issued regularly about where things stand. Enrollment is solid. John, did you tell me that this is actually a record? I saw that email flash by.
Yes, I mean, my understanding is this ties, essentially ties our record going back to 2008.
Okay.
Pretty exciting.
It is exciting. And what's especially exciting about it, and I bet we have some faculty out there as well, is the amount of flexibility that our faculty have been able to put in place so that students can have some options here, and so that we can be ready with whatever changes we need to make depending. So right now we have about 71% of our students who are taking at least one course face-to-face here on the campus, maybe not every day, because we're sometimes alternating groups of students to come into these classrooms that have been reduced in size, but a very substantial online and remote set of offerings as well. And our faculty and the staff have been just phenomenal all summer with both all this planning, but specifically the academic preparation. And we can talk further about that. One concern for us has been, under these very uncertain times, to be sure that we're welcoming students and supporting them well, as the first thing they do when they get to campus is to have a medical test. with a bracelet that allows them to move into their dorm or not. It's a different way to begin college. And I think that our student life personnel have just been phenomenal, particularly in helping welcome the first year students, residential students into this very new world. We can go to the next slide. So with that, I just want to thank everybody for this great partnership that we have. My email is there. Don't hesitate to be in touch. We want to be sure that our communications and our relationships are strong. So with that, I'm going to turn now to my colleagues, Melissa McGinnis, who will introduce herself, and Dick Young, and they'll talk about the Scientific Advisory Board and the testing protocols. And Melissa is the scientific lead for this system-wide Scientific Advisory Board. So Melissa.
Good evening, everyone. So my name is Melissa McGinnis. I am an associate professor of microbiology, and I am a virologist. I've been really delighted to lead the Scientific Advisory Board, which has been chaired by President Freeney Mundy, and has included other faculty members from the University of Maine and the University of Southern Maine. And together we have utilized our expertise in virology, immunology, biomedical sciences, and epidemiology to help the university to make science-based decisions going forward as we face the COVID-19 pandemic. We have been focused on the transmission of the virus and understanding the latest literature on ways in which we can mitigate the transmission of the virus so that we can develop public health responses. We know that it's important that we test widely and that we isolate any individuals that are infected and then find all of their potential contacts and then quarantine those individuals. We also have been consulting on the development of vaccines and treatments for COVID-19 and the importance of testing, which I'll talk more about, and then Dick Young will talk more about the logistics of that process. SARS-CoV-2 is the virus that causes COVID-19. And when someone is infected with SARS-CoV-2, the infected person can expel droplets into the air that contain the virus. And these are known as respiratory droplets. These respiratory droplets can then land in the nose, mouth, and possibly the lungs of individuals who are within close contact of the infected individual. If they are within 3 to 6 feet, someone could become infected. Also, these droplets can land on surfaces and objects. And then when we touch those objects and don't wash our hands, they can be on our fingers, and then we can transmit them directly to ourselves into our nose and mouth when we eat or touch our faces. So we know that prevention really relies on proper ventilation, physical distancing, and that means greater than 6 feet distancing, the use of proper face coverings, cleaning, and hand hygiene. One way in which we can keep our campuses and our communities safe is to avoid the 4 C's. And this is something that the Scientific Advisory Board came up with based on Japan's 3 C's campaign. So we can avoid crowded spaces. We can make sure that we have proper ventilation, opening windows, trying to space out as much as we possibly can. We can avoid crowded places, like the Alphon shown here in this picture. We can avoid close contact. So as much as we want to give bananas a big hug, that's probably not something that we should be doing these days. And I know that that feels a little uncomfortable. I know that when we see one another, we want to shake hands, we want to hug. But for the efforts of public safety and to keep everyone safe, we need to avoid close contact. We also want to avoid our contact time. So a close contact is considered as someone who has been within 6 feet for 15 minutes or more. So if we can reduce our contact time, then we also can reduce the transmission of SARS-CoV-2. We know based on the current guidance for COVID-19 management that it's important to follow the approach of test, trace, isolate. We need to have rapid, high throughput diagnostic testing to test for the virus. And then if we identify someone who is COVID-19 positive, we need to isolate that individual. That individual would be isolated away from the rest of the population until they're healthy enough to return. In addition, we would do contact tracing of any of the close contacts, like I mentioned, within 6 feet for 15 minutes or more. And all of those individuals who are traced would then be quarantined, and they would be quarantined for 14 days until we know that they are then safe to then be returned back into the community. So testing is a really essential part of the arsenal to prevent the spread of COVID-19, and I want to tell you why that is. When someone is infected with SARS-CoV-2, there's a really long incubation period. And that's why this virus has been so difficult to manage and control. The virus can incubate for 2 to 14 days within an infected individual. And during that time, they can be facing a pre-symptomatic or asymptomatic period. So they may not be demonstrating any signs or symptoms of illness. They may feel perfectly fine, or they may have very mild symptoms. But during that time, the virus is still incubating and it's replicating within that person, and they can be shedding the virus and transmitting it to others. If someone becomes ill, then they would be symptomatic. And at this time, the person would contact their healthcare provider, they would go to the Cutler Health Center, and they could be tested. And then depending on the degree of disease progression and complications, there would be a timeline during infection, and then individuals would eventually recover. So what we're trying to capture with asymptomatic testing are these individuals who may be infected with SARS-CoV-2, but they don't have any signs or symptoms. And so we want to identify those individuals and then remove them from the population, identify their contacts, and quarantine those individuals. So we have developed a comprehensive COVID-19 testing plan, and this includes baseline campus COVID-19 testing. And so everyone that came from out of state was tested upon arrival to campus as part of our phase 1 testing. This testing also included anyone that would be living in our residence halls, and then included a third cohort of individuals. And those are individuals who are in special groups such as athletics or musical groups. And Dick Young can talk a little bit more about our testing plan. After that first phase of testing, when they arrived on campus, there was a second phase of testing that was an extension of the baseline testing that was done within 7 to 10 days of the first test. And the reason why is because of that time period that I just explained, that incubation period. We wanted to make sure that we didn't miss anybody during that initial time frame where they could have been just on the beginning end of their infectivity period. We want to make sure that we identify any of those positive individuals as well. Anyone who's symptomatic can go and get a test at a local healthcare center or at the Cutler Healthcare Center on campus. In addition to the phase 1 and 2 testing, we're now embarking on phase 3 testing to have COVID-19 surveillance throughout the semester. And in the surveillance plan, we will be testing approximately 10% of the population. This will be a random sample that will include faculty, students, and staff every 10 days. This individual asymptomatic testing will take place in a very similar way to the initial baseline testing. And this basically is done through a partnership with Convenient MD and Jackson Laboratory, where Convenient MD takes the sample and that sample is then couriered to the Jackson Laboratory, where they perform an RT-PCR test, which is the gold standard diagnostic test for SARS-CoV-2. In addition to the individual testing, we also have developed wastewater monitoring, so we can determine if there is an increase in viral shedding from individuals because this virus is shed in the stool. So if we monitor untreated wastewater, we can determine if there is a potential increase in the number of cases that could be on the horizon. In addition, we'll continue to track the community prevalence, as well as our own data that we've been gathering from the initial testing in the phase 1 and phase 2 process. If anyone has any questions that you think that we can help with, we would of course be open to helping all of the members of our community, and I would encourage you to reach out to us. So I think now I'm going to turn it over to Dick Young to talk more about the logistics of the testing process.
Thank you, Melissa. I'll share my screen for everyone here. Again, welcome everyone. I'm going to go through the logistics of the testing protocols. I think keep in mind as we go through this that this is a team effort that put together this entire operations. The science committee has done a wonderful job in doing the planning for the testing and laying out our process. And the emergency operation committee and with the help of the science committee and others have actually put together this the protocols and the logistics for it to happen. What you're seeing here on the screen, just quickly to mention to you, is the Alfond Arena. That is one of our testing sites. It's on the north to west side of the building. It's worked out very effectively for the special groups that we have in that particular site. And we test up on the hill as well, and I'll get to that for a little bit more here as we go through it. I think the testing protocols are important to keep in mind. When we set this up, we looked at it from the system-wide discussion and from the science committee, and we've come up with a protocols that are more stringent than the state of Maine in terms of our testing. We are testing all out-of-state students regardless of the state they come from. I think that's important to keep in mind. as well as we are testing all students who are living in our congregate living and our residence halls. And we're also testing the special groups. So what we look at here, we have out-of-state students living in one or more face-to-face credits because we wanted to keep them connected to campus and coming to campus is about 2,380, right? And that's changing slightly as testing goes here in phase 2. We are getting some more expansion into some of the other students who are interested as things start to percolate through the community on potential cases out there or might be, or the news reports. We're seeing people walk up the testing site. We're not refusing anyone, we are testing. All students living in our housing are tested. That's in-state and out-of-state. And that includes our fraternity groups. So all fraternities were tested on the in August when they first came here. They were also all out-of-state and in-state fraternity groups. And then our special groups are ones that go out in the community, as well as our marching band, our ensembles, our dancing, athletics, the ones that go out and do student teaching. We also resident hall staff, as well as the resident hall custodians were offered the opportunity. And then we've also been doing new faculty and staff, as well as graduate assistants coming from out of state. And in that group is also ones who travel. So ones who have come to us and said, hey, we've traveled out of state, we've worked them into the testing protocol. So it's been a real great opportunity and meet a lot of people, and it's been going along real well. So appreciate everybody's support on it. The logistics part of the testing, as I mentioned first, we have the Alfond Arena with special populations. You're seeing a picture there of where we actually bring them in. The testing is done there in stations. Convenient MD is our partner. They do the actual sampling, and then they are packaged up and taken off to the courier system to the JAX lab down in Farmington, Connecticut. You see a picture here, and President Faridi Monday had a live picture of it. This is a one that I've captured, and I've got to get that live picture now that she had shown tonight. Is our drive-through tester. This has been, I think, one of the great features of our testing. It's been a real time saver. It's been efficient. The EOC went through this process and came up with a determination of how many cars we can put through. And to be honest with you, we're running about 4 bays. We haven't actually opened up the 6th bay at any one time. And we've been doing 700 to 800 students a day. So you can see how efficient, how quickly people are moving through our testing facility and as they come onto campus. We actually, again, they mentioned about the color bands. Most of that was just to make sure that everybody went through the testing procedure on campus. We've had good response in that. And we've also had students who have come back up to the tent if they don't have their band, and we've provided the band. So everybody's been right on board with that. The Res Life staff has been great on the back end of making sure that's happening. The change of custody is critical here. Obviously, we're dealing with a lot of individuals, a lot of information, and making sure that the tube is matched to the person, and that match goes into the chest, and then that goes to Jackson Lab, and everything is connected on the other end. So when we report out, we're reporting on the right person's results. And that's been flawless. We've had a real good one-to-one match on that going through the process. We are looking at, excuse me, everyone that was tested was put into quarantine. So they have been very good. I have to really commend the student staff and the Res Life staff. We've had very few complaints, very few coming back through from students. They have been adhering to the quarantine. It is difficult. You can imagine staying in a room or in a facility, only leaving to go eat your dinner and then coming back for 24 to 72 hours. And some of them were up to a little longer than that. So very, very well response from the students, and they have been communicating with us on a regular basis, and we've been getting back to them. So it's been going along real well in that particular area. Results are reported right now. We are hitting around, we kind of lulled a little bit towards the end of it because we got such large numbers coming in towards the end of the week. If you can imagine, a lot of people, the Avenue and the Reserve, they had specific days. My light went out. If you don't move in my office, my light goes out. They have move-in day, the 26th and the 28th. So that actually filled up our towards the end of the week. So we had a little bit of a lag on processing, probably getting closer to 72 hours, but now we're back on task. We've already tested Monday's tests have already come in. So that's a really good sign with 2-day turnaround on our tests. So we're really excited about that. Processing, we send them down with the couriers. They've been going roughly 3 runs a day to make sure that we meet timetables down at Farmington to get them into the Jackson Lab. Jackson Lab has been processing on weekends. So for anyone who wants to know how those results, we're seeing results come in all weekend long, and we're reaching out to students. and they have a portal access to go in and log in. The portal access is something that we've worked on, and I believe now it's fully operational, up and going. So anybody going forward from a student in phase 2 testing should be able to check their results on any time that they want to check them. In terms of the positive route, I want to make sure and assure everybody this has been very well done by everyone. We're getting positive response for those at a very small number. We've only had 4 through our asymptomatic testing. And we've done over 7,000 tests now. So that's a pretty good number if you want to. I don't do statistics on that, but I'm sure the mathematicians could give me the percentage on that. So we're low numbers. Convenient MD and risk management from the UMS calls us ahead of time. So they're pulling those labs out before they even get posted up onto our data feed. So we're getting instantaneous communication on the positive results. We then initiate the humane resource team, and that would be Lori Sedelko's group who goes out and talks to them about getting them connected. So we're in constant contact with these students as they go, if they've been positive or in a situation where they might be. We have constant contact with them. We make sure their needs are met. And if we do have to locate them in a different situation, we worked with them all the way through to that. So it's been very, very well done. And from my perspective, and the students have been good response back from them. Jackson Lab notifies the Maine CDC, and then we have 2 CDC representatives who have been assigned to the University of Maine. Jessica Fogg is the one that is our lead, who meet with her. We meet with her weekly and go over our cases and how we're handling those cases, and go through a briefing and get any updates that we need to do. And we're also in communication daily with our case manager for the university. So constant contact with the Maine CDC, and our rapid response committee, which is up and going all day long. We're in conference on Zoom, and we're communicating back and forth on all these cases and students and what may be going on in the communities, plus what's happening at the testing tent. Cutler Health Center has been doing symptomatic and close contact testing, and we've been getting about 24-hour turnarounds on the results, which I got to commend Northern Light for being supportive and a great partner for us. They've turned them around within 24 to 30 hours. We're getting results back on these students so we can respond. That doesn't mean that student wasn't put in quarantine or put in isolation. That's already happened. They've already been connected with dining. They've already been connected with our resources. It's just that then we can talk to the student about what the results may be and then move forward with whatever plan there needs to be for them. Isolation spaces, it was mentioned earlier by President Farini Monday. We do have a lot of spaces available. The 48 spaces in Bowman Nelson, we have 145 in Knox. And we've got additional spaces in the community. So we are pushing up around 280 to 300 spaces available. We do have more spaces that's not shown here that are available, but again, not in these particular buildings, and we're using those as reserve if we need them. There is a transportation van for those who may want to know that's been put together by facilities, and Jeremy Chubbuck has done a great job of putting that together. And he's got a team that transports the students from the residence halls to these isolations and quarantine spaces. So they are all provided an opportunity to get them located. And obviously we have a COVID cleaning, which has been initiated with a fraternity, and we've done it here on campus with a class space here. It's actually been a pretty good thing to see it work. And when I see from my perspective, everything's been falling into place really, really well at this point in time. We've tested all our systems and things are working well. So thank you. And then if anyone has any questions on the testing logistics, I'm more than happy to answer them. I turn it back to President Farini Monday.
Thanks very much, Melissa and Dick. Terrific, terrific information. And I know that people are sending in their questions. If you need to send a question in, the way to do that is to send it to the email address that I'm about to give you, umaine.alerts@maine.edu.
Oops, I got to share.
Those are coming in, and we'll work our way through them. But first, let's go now to our colleagues and neighbors, and hear first from Sophie about her comments on the overview, any kinds of overview comments about the health and safety measures enacted in Orono, and anything else that you'd like to bring up. Sophie, thanks again for being here.
Well, thanks again for having me. I'm going to share my screen. So Orono is among the very few things that are bigger on the inside. Every year, we are so fortunate to welcome new residents who bring a diversity and a vibrancy to our community, making us incredibly unique as our small rural community swells to welcome approximately 11,000 students to the University of Maine. Over the last several years, the town has worked very hard with the university to build shared understanding that good neighbors make good neighborhoods. Along with the routine reminders that good neighbors make good neighborhoods that we're used to giving every year, like take care of your trash, don't park on the lawns, comply with the noise ordinance. This year, we're also reminding everybody that being a good neighbor includes keeping our community safe and practicing good COVID protocols. So you talked about your teams. Well, in Orono, we have a pretty active team that is working on a public health response, and that includes a lot of planning, emergency response services, technical support and guidance, and education and outreach. This is actually run through multiple departments, the town manager's office, the fire department, the police department, Office of Community and Economic Development are also working very diligently to put together a cohesive and consistent public health response. You remember the part where I said Orono was a small rural community, which means that we're small. We need partners in order to really make an effective response. Our partners are with the state of Maine. Governor Mills, her office provides guidance, the Maine CDC, the Department of Economic and Community Development, the Attorney General's office, and the Maine Emergency Management Agency. They all feel quite far away. Our primary partnership these days is across the bridge with the University of Maine. And, you know, for years we've worked to build good communication, and we have seen that pay dividends as we have worked collaboratively to put together good virus response and prevention in Orono. So that's through the President's office. The Student Life is one of our primary contacts. The Emergency Operations Center, we actually are linked in with the Emergency Operations Center and have a seat at the table to understand what the university is doing and also to learn, which has helped inform our response. And we've been very active with the Return to Campus Planning Committee. So our virus response and prevention is really around public outreach and education, looking at regulations and then compliance efforts. Education and outreach in Orono looks like technical support that is provided primarily through the fire department and the Office of Community Development to area businesses, off-campus rental complexes and nursing homes, helping them understand how to best comply with state and local rules. We have signage that I hope people have enjoyed and as reminders for pedestrians and welcome signs at the gateways. Our social media, our Facebook pages and our website also include education around COVID-19. We also work with the university to distribute welcome wellness packets to large off-campus residential housing facilities to help co-brand and make sure that people had good information and the material that they needed to comply with the Black Bear Pact, both on and off campus. So coming soon, we will have we received a grant that is going to allow us to put a new message board out at Town Hall. So we'll be able to communicate more messages in real time, which should be very helpful. And we also are developing an outdoor adventure scavenger hunt for families, residents, visitors to begin to understand Orono and the best practices for preventing the spread of COVID-19. So we talk about regulations. The state of Maine has issued when we were putting this presentation together, it was a little over 50, and they just keep coming in. Executive orders that dictate how we should be dealing in the public. As an added layer of protection in Orono, the Orono Town Council adopted an emergency ordinance. That emergency ordinance requires that face coverings be worn while entering or inside a place of business that is open to the public. If you're outdoors interacting with someone and you can't maintain social distance, you must have a face covering. If you are using or providing public or commercial transportation, if you get on the Black Bear Express, you must have a face covering. And if you're participated in a permitted or allowable gathering, you must have a face covering. All employees that work in businesses that are open to the public in Orono are required to have face covering when they are interacting with people. Of course, there are some exemptions. The most notable would be for people who have medical or mental health conditions or a disability that don't allow them to wear a face covering. Our ordinance also requires that businesses enforce the ordinance at their establishment. So if you go into a business and you're asked to put a face mask on, know that the town is requiring that. We really are hoping that you will help businesses comply with the town. Large residential housing complexes are required to submit a plan that addresses preventing and responding to the spread of the virus on their property. The fire chief will approve the plan, provided that it complies with CDC guidance, and then complexes are required to enforce the plan. The ordinance also provides my office enforcement authority to levy fines for non-compliance. And my goal is to not have to levy any fines, but the option is there. For people who are interested in seeing the full text, this is a 4-page ordinance, so there is quite a bit of text. It is available online on the town's website, www.orono.org. So when we talk about enforcement, we don't want to levy fines. We want people to comply. So our number one goal is to educate, to provide assistance, to help with compliance. We are leaning heavily on our partnership with the university to reinforce communications around compliance and the Office of Student Conduct to help us with people who we cannot get voluntary compliance from. We're also counting on our community to use peer pressure. It works. And we think that the norm, if the expectation is when you're in Orono, you're using good COVID-19 prevention protocols, we will be in a much better place. So the university has done an amazing job bringing people safely into our community. You know, we couldn't have asked for a better lead up to the beginning of the school year. We will maintain our partnership with the university. We plan to continually evaluate what is happening on the ground. We have built our entire plan to be adaptable and to be ready to change our response, to pivot as needed. It's nice to know that we both like the Maine hello. So it bears repeating. Wear your face mask, wash your hands, and want your 6 feet of social distance. We in the town of Orono want everybody to come enjoy the time that they have here, but help keep our community healthy and our businesses open.
Thank you so much, Sophie. That was great. And I just, even without coordinating our presentations, there's just so much synergy here and so much alignment. It's terrific. A sign of a deep and long partnership here. So wonderful. Travis, do you want to tell us a bit about what's happening in Old Town?
Yes, thank you for inviting us to be part of this. I won't share my screen. I'm not even going to try to upstage Sophie after that, but that was a good job. As we all know, this thing is in a state of constant flux, so we too are assessing every day, trying to keep everything adaptable as we can, and responding to whatever the next change is. As was mentioned, over 50 executive orders have come out, so just keeping up with those can be time consuming, and understanding what they mean for our communities, reaching out and answering questions, trying to keep staff educated and safe, and making the changes required in our public safety and EMS. We've always, without repeating what's already been said here, we've always enjoyed a great working relationship with the university. The city manager keeps me informed regularly of the correspondence between university staff and the leadership and what's going on with the plan. And we stay updated. I too haven't seen Mr. Dana for a long time and used to see him very often, but in a former life. But anyways, Old Town really enjoys the relationship between Old Town Orono and the university. We're going to beat this thing together, not individually. We have just recently used some flyers that were produced by the university to send out to nearly 440 property owners in town that have 2 units or more, asking them to please share them with their tenants, regardless of whether they're students or not, just trying to get the word out there more about how best to limit the spread of this virus. We look forward to continue working with all of our partners in both the university and in Orono. We know that this is going to take a combined effort to get through this, and we're probably not done for some time to come.
Thank you so much. So we've had questions coming in, and the way that we've done this previously, and so we'll keep trying to do it this way, is I'll try to kind of cue people that they've got a question coming, but then ask somebody else a question first. So the first person has to kind of deal with it, but we'll have that be Robert. So for our neighbors in Orono and Old Town, questions like, why are the local grocery stores not 100% mandating mask wearing? Why are we not enforcing masks for employees at City Hall in Old Town? A person who speaks of her parent in an elderly housing unit. Why are people not necessarily required to wear masks in some of these places? And are town officials required to wear masks when interacting with the public in Orono? So those are coming. But in the meantime, let me start with one that really is for Robert. And it's about student behavior off campus. And it says students who live off campus are protecting their health and the health of other residents. They should be protecting their health and the health of other residents. They're walking around without masks and walking without social distancing. How does the university plan to address this?
Well, thank you. Before I go forward, I only remember Travis Roy as the student leader, a magnificent student and a great citizen of Old Town. So that's the first thing. We're spending a lot of time with our off-campus students, and Orono has been a tremendous help in this respect, both in terms of their ordinance, but also in sharing all the information that they're sharing throughout the town and with housing complexes, and same with Old Town. That's a huge piece of the puzzle. But some people will feel as though they're invulnerable or they're not taking this seriously, but we're noticing a great uptick on campus and off campus now, with students really wearing masks and paying attention to the social distancing expectations. Where they don't, and you probably read about this, the chiefs of the local police department have been great partners with us, and Chief Ewing particularly right now has had the unhappy opportunity to send us some 8 cases, and each one of those situations result in quite severe student conduct outcomes. one student was suspended, in fact. So these were for party events. They weren't huge parties. They weren't raves. They weren't, 100 people. They were much smaller, but they were breaking those rules and expectations. And at the university, and I know in the towns, we know exactly well that how this is going to happen is that everybody's got to be pulling in the same direction. Each and every one of us has got to have personal responsibility. We have to take responsibility for our fellow citizens. We have to care about each other. And at least from the university's perspective, we're going to have a big prevention program, which is happening and appears to be working. We're going to have high expectations, which are stated over and over and over again, and we're going to have an enforcement component.
And it's just so reassuring to hear our partners in our nearby towns on the same page with us on that, and to know the great work they're doing. So you're right, it's going to happen together. Just a heads up to Melissa and Dick, several testing questions coming. A lot of them about the testing of faculty and staff and how we can be sure that we're protecting everybody as thoroughly as we can. But before that, let's see if our colleagues from Orono or Old Town would like to address that group of questions, a lot of which have to do with the mandating of mask wearing. Sophie, you want to start?
Sure.
Thanks.
So the first question that I see is, why are the local grocery stores not 100% mandating the masks in their stores? I want to remind people that there are exemptions to the rule about mask wearing. Would also want to remind people that Orono's ordinance was passed last week. So we're still educating businesses. I think, as I said in my presentation, peer pressure and coming together as a community, much like what Dr. Dana just said, is the way that we're going to make a difference. We do not have enough enforcement personnel to be out tapping people on the shoulders for not wearing their face covering. And quite honestly, I don't think we would want to deploy our staff in that way. If you're seeing an issue where there is a particular business in Orono that is not complying with the ordinance requirement, then you should contact the town, most specifically our public health officer, Rob St. Louis, who will then go out and have a conversation with the business and help them understand how they could better comply. I don't know if Travis has anything he wants to add.
Yeah, I'll just add that we too are currently evaluating what we can do with the businesses to help get the information out there, making sure that they know about the DECD guidelines for being open and allowing customers inside the buildings. Our health officer is Dave Russell, the code enforcement officer. He's always available by email and or phone, but he's pretty easy to get a hold of, and we would certainly help you with that. As far as the policy for in the town hall, we are allowing people to work in private office spaces without a mask on during the day. If someone joins them in their office that's not from an immediate staff that works with them routinely, they're to wear a mask if they can't maintain 6 foot of social distance. And the people on the front counter have the plexiglass blocking them from the public, so they are not required to wear masks when they are working behind the plexiglass. Like with all things, some people are forgetful. We have to remind people. I think that's just part of being human nature. And as Ms. Wilson has suggested, not everybody agrees with this. So sometimes it's a challenge to remind some people more than once. But we are serious about that policy, and we do expect our people to follow that.
Thank you both so much. And in our own way here on campus, we have a version of this too. I just went into a building to go to a meeting this afternoon, and there was a student studying all by himself, far away from everything, with his mask kind of down around his chin. And he just looked at me and like nervously put the mask back up. So I was grateful for that, because I think it's easy to, it's a constant reminding kind of mode. So there are several questions, both about testing And there's an interesting one here about the scientific evidence upon which the mask wearing has become mandatory. But before we go to those, and Dick and Melissa, I know are ready, there is a question that I wanted to take up that has to do with, it's a question I get asked a lot. Several of us get asked this, and now I've lost it. It has to do with, is there some, yes. This person is a parent of children attending schools in the area and a faculty member at UMaine. Asks about a decision point for the number of cases in the University of Maine system that would trigger a move to a full remote like we did last spring. So that comes up a lot. And the more that I learn about all of this, the more I understand how complicated all of it is. And so we, first of all, across the full University of Maine system, you can imagine that circumstances in USM's neighborhood in Portland could be radically different than what we might have happening in Machias. So one thing is that, of course, we need to look by the location of the campus, by the context and what's happening in the nearby towns and in the counties where these institutions are located. But at the same time, there are so many factors that have to do with the nature of the set of cases, right? If these cases are sort of disconnected, which is pretty much what we're seeing now here at UMaine, I believe, then that's one kind of situation. And we're working very closely with Maine CDC, who are the experts and provide the guidance really on exactly how we handle and think about and even talk about cases and outbreaks and so forth. So we've got a lot of tremendous expertise guiding us there. We have our isolation space that Dick has described, and that becomes an important factor as well. So we are well aware that we will need to consider a lot. And of course, the safety of everyone is foremost in all of that. With that, let me go to Melissa and Dick to see if you'd like to take up some of these other testing questions, because they're good and interesting questions. Melissa, you want to go first?
Sure. And Dick can jump in too. I don't want to steal your thunder, Dick. So there's been a question about testing of faculty and staff and why they're not included in the testing protocol. Some faculty and staff actually are included in the testing protocol. So I just want to clarify that. So faculty and staff that are arriving from out of state were tested just like students that are arriving from out of state. And we also have some staff members that work closely with students that are being tested as well. And that would include people that are involved in athletics, for example. So I just want to clarify that point. And then also just to let you know that in our phase 3 testing, there will be the inclusion of faculty and staff as well as students. And as I mentioned, we're planning to test approximately 10% of the population every 10 days, or you can think of that as 1% of the population every day. And so anyone that has an in-person experience would be included in that. So people that are working 100% remotely or students that are entirely online will not be included in that random sampling. So that's answering another question that came in. There was another question also about if the increase in the number of cases we've seen in our local area due to the Millinocket cases is kind of impacting our decisions. And we certainly are aware of that. We're tracking that. Initially, when we were thinking about the testing and which groups should be included, we were focusing mostly on those arriving from out of state and those who would be residing at our residence halls and other cohorts that were at the highest level of risk. And so testing is essential. And believe me, I have been out here advocating for testing since March, but I will tell you that wearing face coverings is even more important than testing. And we've seen that in the data. We've seen that really nationwide, where we see increases in the number of cases and major outbreaks. That's occurring in places where bars and restaurants open too quickly, and in places where we see large family gatherings where people are gathering without face coverings. So there's some really interesting anecdotal evidence. One story that I like to share that I think might be important to think about as we just think about people who are interacting in our communities. There was a case in Missouri where there was an employee of Great Clips, so the hair cutting place. There were 2 employees who were ill with coronavirus this summer. And one was actually symptomatic and went to work anyway. And those individuals were wearing face coverings. They had 150 customers come in that day, and they were all wearing face coverings. And there's not a single case from those individuals who are working at Great Clips. No cases of transmission in that example. But the examples we hear about are those who are in bars, restaurants, those who are gathering in large types of gatherings like families or weddings where they're not wearing face coverings. And so I just want to emphasize that that really is important, and I really applaud the town of Orono for including this emergency ordinance as well. But of course, testing is important, but it's not the only piece. This is part of a multi-layered plan that we have in place. There's been some questions about where do you go for the most up-to-date information? Maybe if I can share my screen, I think that it might be helpful just to show you where you can go to find the metrics. So can everyone see this is our Together for Maine site? I'm sorry, I'm just looking at my other screen. So this is our Together for Maine site. And if you scroll down, you'll see our dashboard with the asymptomatic testing summary. So these are all of the asymptomatic tests that have been done across the UMaine system. So you can see that so far throughout the system, we've done 7,543 tests, and there have been 6 positive tests throughout the system. If you want to have more granularity to know where these positive tests have occurred, in addition, if you want to know the tests that have come up as positive that are not part of this asymptomatic testing plan, but have come about because a student was symptomatic and went and got a test because they were feeling ill or because they were a close contact, those are being reported daily. So there's a daily press release that's coming out. I think it's coming out every day at 1 p.m. and that's updated. So then you can determine where the cases are occurring on each campus throughout the University of Maine system. So you can see, just if I scroll down, that every single day there is an update so that you'll know how many positive cases there are on every single campus. If you're looking for data for the Penobscot County region, for instance, you can go to the maine.gov site and you can look at the number of cases, for instance, in Penobscot County. If you continue to scroll down, you can also see that, you can see the cases by county, and you can even go in by zip code. So if you want to go into Penobscot County, for instance, you can go into the Millinocket area and you can see that there are 28 probable or confirmed cases. If you go into the Medway Penobscot area, you can see that there are 13 probable or confirmed cases. So I think that using these metrics, you'll be able to determine the number of cases that are going on around you if you are concerned about that. So I would encourage you to use those sources, and I can post them in the chat if you're interested. I'll see if there's anything I missed. And I would also ask Dick to chime in if he has anything to add to that.
You've done a great job on that, Melissa. Thank you.
Okay, sure.
That was great. There is one about, let me find it again, sorry. How about where people might go if they wish to be tested?
If students or faculty or staff, we are testing still up on the hill by the AmeriCenter, the convenient MD site. We'll be there all day tomorrow from 8 to 4, and then we'll be there Monday and Tuesday from 8 to 4. So that is phase 2 testing, but we have not turned away people who've coming in. As long as they're willing to fill out the release forms and go through the process, they are tested.
Excellent, thank you. There are a couple of questions that are very specific to the campus. Why aren't campus parking passes discounted since students won't be able to use them after the break? It reminds me that we need to be clear about our calendar too. I'm not sure we've said that, but we have made the decision across the system to send students home from campus or to move fully to remote instruction right after Thanksgiving. So our last day will likely be the Wednesday before Thanksgiving, and then the campus will clear out and we will conduct the rest of the semester remotely. We've also made the announcement that we will be beginning the spring semester 1 week late and not holding a spring break, which of course is again a scientifically based decision, because we do know that if students go away and then come back, the probability of bringing this virus back if they've been somewhere on spring break is high. So we are encouraging our students to stay nearby and to, of course, participate in the testing. One question, there are more questions still about what to do when students are getting together off campus, coming and going, not social distancing, not complying with masks and so forth. And I've seen a note added here. I don't know if people can see this, but Robert, do you want to speak to that, or someone in your team?
Well, yeah, I will ask others to chime in. I will say if you know of hot spots or places where this is happening, please reach out to me. You can find me easily on the University of Maine website, Robert Dana, and we have a lot of folks that deploy into the town to interact with students. So we're happy to talk to them, and we're also happy to engage town officials in this as well. But if you know of some place where it's happening frequently and you can give us good directions or a name, we'll be happy to look into it.
Couple of additional questions about masks that some of you have seen. Why is it required that at the farmer's market, which takes place in open air, that social distancing, and where social distancing is practiced, why require, or is it necessary to wear masks? And a kind of related question, when bicycling to work from home, is it mandatory to put on a mask? Anybody who has thoughts about either of those? Yes, Sophie.
I can, I'm going to pass this off to Jeff, because I think the farmer's market was something that we asked them for compliance with.
Yeah, so when the farmers market first started, we worked with them to develop a plan in relation to social distancing and processing of payment, pickup of food, those types of things. I'm not sure what they're doing currently. I do know that if they are in fact social distancing as they're supposed to, then in a public space, the mask requirement isn't necessarily required. However, we haven't evaluated it since they've moved to their new location, so it might be worth going up and looking at it. Without question, outside, if social distancing isn't being maintained, then they are required to have a mask on. And again, social distancing is 6 feet or greater. I don't know what the layout is up there. We haven't received any complaints on it, so I'm not sure what's going on exactly, but it's worth us going up and just taking a look. As long as they're compliant with the 6-foot rule, then as it is, we would not need to have them wear masks. If there is some question or it's marginal, then we would require them to wear masks as well. The mask requirement in public spaces is that if you're not able to maintain 6 feet distance, or you're going to be in an area with people more than 15 minutes, then you have to wear a mask, such as was already mentioned. Riding a bicycle, walking on the street, jogging, running, whatever the case may be, typically you're not required to wear a mask. It's when you start congregating, and you're congregating for a period of time. So if you are waiting for a table outside one of the restaurants in town and you're clustered together, then we would expect you to wear a mask. But those other activities we were talking about, you're not required to wear a mask or face covering during them. So bicycling to work or to school would not require you to wear a face covering.
So I'm going to ask if someone from UMaine would like to speak, Roland or Robert, to be specific about what might be slight differences in our campus-specific requirements.
Well, obviously I'll have to let the boss go first if he wants to. Otherwise, I'll speak to that.
Please proceed, Roland.
Well, actually, Chief Lowe did cite the governor's executive orders accurately. However, the university system guidance is a little more strict as far as face coverings go versus the state guidance. So basically, it's anytime you're on campus, you have to have a mask, you have to wear a face covering, with the exception of if you're driving alone in a vehicle, you do not have to have face covering, or if you're alone in an office with a closed door, you do not have to wear face coverings. Other than that, face coverings are required in the University of Maine system.
So thank you for that. Another testing question, if the wastewater testing program, which we didn't talk much about here, but it's one of the more fascinating pieces of this extremely fascinating environment we find ourselves in. But if that finds evidence of the virus, what steps would UMaine take? And would it involve quarantining or testing everyone, let's say in a residence hall? Again, Melissa or Dick, one of you like to say a bit more about how that's working and what we do when we get some results from it?
Melissa, I think you have more knowledge on the testing piece than I do on that one.
Sure. So those samples are being collected by a local company called CES from Brewer. And when the samples are collected, they're being tested in our own in-house laboratory now at the University of Maine by some of our University of Maine researchers. If they determine that there is something that looks like it could be a potential rise in the amount of virus in the wastewater, then they would also do a retest to confirm that that is a positive. And then from that, they would then talk with the incident commander and the emergency operations committee. And that would allow us to make some actionable decisions. And so based on that information, we could potentially zero in on particular areas of campus to determine where it might be coming from. So for instance, you can do sampling on particular buildings, and that might be a possibility if we're able to actually get into that level of detail. In that case, then, you know, an example is that we might ask all of the individuals in that residence hall to be tested. And so we would make some actionable decisions just based on that information, and that might be an increase in the level of testing. At that time, if people were tested, we also could just reiterate all of our public health and safety rules. So of course we would be reminding people about face coverings, physical distancing, hand hygiene. If things really started to look very serious, then, you know, maybe we would move into other types of decisions. But I think that anytime we have a reminder that the virus is with us and it's not going anywhere, then those are good times in which we can remind everyone to make sure that they're following all of the safety precautions that we have set in place.
You know, I hope people are hearing through all of this our very strong commitment to and belief in, based on the science, the importance of the testing and the face coverings and many other things. But back to the testing, there are a couple of questions now that I will turn to Dick for help on. I'll take a stab at them, but one is, what's the best way for staff who want a test to have that done? And then secondly, if faculty teaching off campus believe they've had contact with someone with symptoms or known to have COVID-19, can that faculty member get a test on campus? So the first principle here is we're in favor of the testing. And for people who feel that they've been in touch with a potential carrier of the disease, for people who have symptoms, there are multiple avenues for how to pursue those tests. And if people are in categories that are perhaps vulnerable and feel there's a need for a test, we want to encourage and support that. There are lots of ways to do it now. The governor has a standing order that's very broad that would allow most individuals to seek a test at the increasingly large number of swab and send sites. But Dick, I think the question is specifically about what's possible on campus. So perhaps you can speak to that.
Okay, for those, to answer the first question, those interested in getting tested on campus, faculty or staff, I would encourage them to send an email to um.covidtesting@maine.edu and put in there that you're requesting a test. And we have several people behind that are following it, and they will reach out to you and send you a Google form, which gives you the opportunity to pick and select a time you may show up at the testing tent, and then we will put you in and test you. There are 2 additional release forms that need to be signed. We have those at the testing site, or those will be sent to you along in the email as well. And we do send a map along for those who may not be familiar with the Americenter where it is on campus. In terms of testing on campus, if you are around someone or have a belief that you might be symptomatic, there are several ways that we have that communicated. Obviously, one is to contact your healthcare provider. Your local healthcare provider would be number one. We also have the ability to contact the health center. And then we do have the COVID line that's being monitored throughout the day. And that's a 581-2681 number, 581-2681. And I believe that is one of the quickest ways to get in, because that feeds right back into the EOC, that feeds back into the communication network on campus. So we can support you and determine whether it's symptomatic testing or asymptomatic testing, or we also can send someone out to talk to you to see who you may have been in contact with and what the depth of it might entail. So we ensure that we deploy the right resources to support you and get you in the testing as soon as possible. So that 581-2681 number is a good number to call if you're on campus and seeking testing.
Thanks a lot, Dick. Thank you.
Sure.
There's still, Travis, there's still this question about elderly housing units in Old Town. and whether there are expectations of masks in the hallways when people are visiting there.
I can't specifically speak for the housing authority that manages most of those. We will certainly look into it and ask what they're doing. However, as many have pointed out, there are many directives throughout the state that have been issued, and I'm not particularly familiar with one in that type of housing unit that makes the mask mandatory. We will certainly have the conversation with them and see what we can do to promote maybe some information campaigns in those locations on the doors, things like that, to help get a little more voluntary compliance, the peer pressure that someone spoke of earlier, and just try to get people to do the right thing for those residents to help reduce their risk.
Thank you. Thank you. That's great. Jeremy, here's one for you if you're still out there. When is the Wallace Pool going to be reopened?
Well, good evening again. That's a very good question. I'm not sure what the plan is with athletics at this point. That's probably best answered by Ken Ralph or one of his folks, because I'm sure it has to do with the athletic scheduling, which unfortunately I'm not knowledgeable of.
Yeah, I'd be surprised if it opens. Kenda, if you're still there, we have 2 pools on campus, but they're environmentally, I think, potentially too friendly to all sorts of viruses. So Kenda, are you aware of where we're at with that? Are you still here? She had to take care of another problem. I expect it may not open. That would be my honest
Yeah,
answer.
we have, so opening plans are still coming through the EOC and into my office when they affect, the entire campus or the community. And we have not seen that one yet, Kimberly, correct? You're muted.
I'm sorry, no, not to my knowledge.
School plans, okay. So we can assume a no on that. We're coming to the end of our time. I think we did have a question about scientific evidence upon which the mask wearing has become mandatory. Melissa has spoken to that to some extent. And I don't know, Melissa, if there's more you'd wish to say, but you talked about a couple of examples, and I know there's been a fair bit of research about it.
Yeah, there has been a lot of really great research, and we know that wearing a mask protects those around us because it can help to trap the virus respiratory droplets as well as any aerosols, which are micro droplets that can be produced and expelled, and that can lead to viral transmission. And there's new data actually to suggest also that wearing a mask can protect yourself. So we're protecting those around us, and we are also protecting ourselves. We should also remember that face shields are not really a one-to-one replacement for a traditional type of mask that would cover the nose and mouth and be tied around the head or around the ears. The data suggests that those micro droplets that I just spoke about actually can be released from the sides and the bottom of those face shields. In addition, gaiters are not a safe protective covering, and the research supports that. Also, just want to go back to the point about the farmers market. And I think that those regulations that are in place are really excellent. So if we are outdoors, our risk for transmission and contagion are lowered by about 20 times. And in part, it's because, the virus is getting diluted in the air, and because there's always a little bit of wind. And so those droplets can fall to the ground more easily when we're outside with great ventilation. And so if we are outside, though, we still are at risk. And if you're outside for a long period of time and you're having a close conversation with someone, you're at an increased risk. So the majority of cases that have been reported have been from indoors, from crowded places, from close contact, from family members. But there are actually cases that have been reported outdoors. And in those instances, usually it has to do with maybe people are gathering on a boat or a party and they're outdoors all day, but when they're sitting next to each other having a conversation, there can be transmission. Or maybe they're gathering at a barbecue setting and they feel safe because they're outside and they're around people that they know. But actually, if you are in close contact, even if you're outdoors, your risk is not ever 0%. So that's just something to keep in mind. And so I think that having face coverings at the farmer's market is definitely a good call.
Thank you. And we'll do a quick invitation to anyone who hasn't had a chance to say much to see if there's anything they would like to add as we wrap up. The last question, though, what should a person do if he or she has problems breathing with a mask? And I assume that some of that might be specifically about those who are on campus. Robert, want to give some direction there?
Yeah, well, certainly we don't want confrontation. We don't want argumentative engagement. I think it's reasonable to practice this, and we've encouraged people to even look in the mirror because it's a little make people a little uptight to have to initiate these discussions. We'd like to, I like to call it dance, don't box. And if you can just ask somebody, were they aware that the masks, for instance, are required and expected and would really help? You'll get a sense almost immediately how people are going to respond. And if they're not going to respond well, I recommend that you walk away. There are plenty of ways to report folks who are not engaging in the behavior. You can do it anonymously or directly through the COVID line, 581-2681, or we have an anonymous reporting mechanism as well. But in any public health campaign, persuasion is preferred over argument and vigilantism, if you want to call it that.
And if people truly have a breathing issue, of course, depending on their circumstances, they come and talk to us. Dick may want to add.
Yeah, we've referred those, President Farini Monday, to EO if they're an employee or student support services, accessibility services on campus for those who have issues, and they'll review the case with them and go through it and come up with a plan for us.
Excellent. So with that, as we close in here, I'm going to suggest that if you'd like to say any more words, just maybe raise your hand or raise your hand through the technological means, or just do the regular old raise your hand. But I will actually call on our provost, John Vollen, who is, again, new to our community and hearing a lot about how wonderful our community is in terms of its partnerships with our towns through this call. So John, I'll put you on the spot and ask you if you'd like to make any comments.
Well, I appreciate that. Thank you. You know, I've heard some of these presentations before, and every time I pick up something new, and it just has to reassure people, hopefully out there, just the amount of work and thought and commitment that has gone into prepping, and it really inspires me. And I will also say we kind of started out tonight talking about the large number of students on campus, and we've been in classes for a few days now, starting Monday, and we've had, other than a few expected technical glitches here and there, for the most part, we've had incredible positive feedback from our students and faculty and staff, so I'll end it on that positive note, and I hope it continues to go the way it has so far. And thank you all for this really great conversation. I'm really impressed with the relationship between the university and Orono and Old Town. It's really wonderful.
It is. Anyone else with last comments or encouragement or?
Could I ask Lori to speak just very briefly to the Black Bears Care Plan and the pledge, and then Andrea, who heads up our off-campus commuter student programs, if she could just say a word about how you can reach her.
Sure. Hi, everyone. I just worked on the Black Bear Pledge and the Black Bears Care Plan, and that is to protect ourselves, protect others, and protect the College of Our Heart always. And a major part of that is all of these things that we've talked about tonight. One of the key things I think, though, that I've picked up in the past couple of weeks since students have been back is that everybody wants to be back. We all want to be on campus. It was very disruptive last March when we all had to leave, and it made a lot of people feel very sad. So a reminder to students that we want to be here, and that's why we're doing this. That's why we're protecting each other. That's why we're pledging safety. That's why we're taking care of each other. It really is the humane way, and we follow the pledge so that we can stay here together.
Thank you.
Hi all, it's Andrea. We've worked really close. Thank you, very, very much to the, I'm going to give a shout out to the town of Orono, because as part of someone who oversees the commuter population, they really stepped up, and we provided some kits, wellness kits, to our on-campus students, and we ordered some of those for the off-campus students, and the town of Orono graciously offered to distribute those and took them to the large student housing complexes off campus and got those in the hands of our commuter students. And in them were, yes, some well care things, but also some information about how to keep yourself safe, what to do if you do have questions, who do you contact for this. So that was all given to our commuter students, and they have responded quite positively, and we've had a lot of questions from them. We are also, like Lori talked about, the care plan. You know, if there is an off-campus student who reports that they're ill or they've tested positive or something, we are providing care managers to check in with them daily as well, and speaking with their family members to reassure them that yes, they may live in the community, but we're here to support them as well and make sure that they have anything that they may need and that they're taken care of.
Great. And I hear Travis is going to chime in.
Yeah, I just wanted to say thank you for including us in the conversation. It's all great information. We're glad to be part of it. And I think we'd be remiss if we didn't thank our public safety people out there on the front lines, whether it's UVAC, Old Town, Orono, or all the other towns that back them up, because they're keeping us and our families safe at home. So thank you to all of them.
Absolutely. Second that. Great. Well, then, I think we will close. This was wonderful to have everybody together. I hope we've been able to answer questions for the folks in the audience, but we've given you ideas about how to reach us as you need to, and how to reach our colleagues in Orono and Old Town. And just know that this is a very committed community with great working relationships and continued focus on our mutual goals, which are to keep our communities safe and healthy. Thanks all, and have a good evening. Bye-bye.